Hey guys, what's going on? This is Wahaj, and I'm actually making this video today because I recently talked to my friends after my hernia surgery that I had, and it was my first ever experience in America with American healthcare system. So we had a back and forth debate about which system is better, single payer care system or private care, private, care. So I wanted to find out from you guys, what do you guys think about this? Because to me it doesn't sound very radical that countries like Germany, England, Spain, Portugal, Australia, New Zealand, I mean, for God's sake, England had their healthcare system back in 1948. Germany even has free education. So what do you guys think about this? Do you guys think America should have this system, or America should just continue having employer-based system that we have? Because I wanted to find out if I'm right or if I'm wrong, or is just if I'm somewhere. So please let me know, comment, and subscribe, state your opinion. And a lot of people come to me and say that communism and socialism is almost like same. You're going towards communism. Actually, socialism is completely different. There is social democracies all over the world, like Finland, Norway, Sweden, Denmark. So I'm actually gonna put out a clip here, so the people who don't know will find out that in 1960s, actually, John F. Kennedy was proposing for single payer system or universal payer system, which later on resulted in Medicare and Medicaid program. FDR did Social Security. So there are many things that happened back in America that was actually social, or what the social democracy would do. So let me know. I'll post the link after this, and here it is.
And what they do in England is entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, the choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And I hope that while he's here, he and Dr. Spock and others who have joined us will come to see what we're trying to do. The fact of the matter is that what we are now talking about doing, most of the countries of Europe did years ago. The British did it 30 years ago. We are behind every country pretty nearly in Europe in this matter of medical care for our citizens. And then those who say that this should be left to private effort. In those hospitals in New Jersey where the doctors said they wouldn't treat anyone, who paid their hospital bills through Social Security, those hospitals and every other new hospital, the American people, all of us, contribute 1/2, 1 or 2/3 for every new hospital, the national government. We pay 55% of all the research done. We help young men become doctors. We are concerned with the progress of this country. And those who say that what we are now talking about spoils our great pioneer heritage should remember that the West was settled with two great actions by the national government. One, in President Lincoln's administration, when he gave a homestead to everyone who went west, and in 1862 he set aside government property to build our land-grant colleges. This cooperation between an alert and progressive citizenry and a progressive government is what has made this country great, and we shall continue as long as we have the opportunity to do so.